Varicose veins are not only unsightly, they can cause some serious problems if they aren't treated. That's why I'm at Raleigh Radiology talking with Dr. Mark Knelson. And let's talk about some of the issues. Why do varicose veins happen in the first place?
Typically, most of our patients are women, ladies, and oftentimes they may experience varicose veins after pregnancy. There's some association with the genetics. Oftentimes their sister or their mother might also have varicose veins. It's associated with long periods of standing, and in some patients, they just happen to have them.
And so what are the health risks if they are not treated?
A lot of aching, pain that progresses through the course of the day. They can have burning, they can have itching, and it's unsightly.
Here at Raleigh Radiology, you can treat the situation right here in your office.
Absolutely. When the patients first come to us, we do a complete evaluation, which involves not only a physical exam, but also taking a complete history and looking at other factors in the patient's lives in terms of their opportunity for being treated. But we also do a very careful ultrasound of vein mapping of the leg involved. Often it's both legs, sometimes just one, so that we know exactly the anatomy in terms of which veins are normal and which veins are abnormal. And then we have a number of tools that we can apply to address those problems.
EVLT is one of them?
Absolutely.
And what does that mean?
Endovenous laser therapy, for EVLT, is a laser treatment of the larger varicose veins. The problem basically is that the valves become abnormal and they don't touch completely. So during the course of the day, the blood, instead of continuing back up to the heart in a packet, starts refluxing or falling backwards down into the leg through these incompetent valves. And the vein is abnormal, it's dilated, it's not functioning properly. There's a large range of patients that tolerate this procedure very well, and it really has been a boon.
Fantastic. Well, it was great to learn all about that. Thank you, Dr. Knelson.
Well, thank you.
I'm talking now with Dr. Jason Harris. What exactly is a spider vein?
Spider veins are those unsightly veins, I guess most people would say, the bluish or sometimes reddish, sometimes a little more prominent, sometimes very just flush with the skin, the little tiny veins that women most commonly see on the legs.
Is it mostly women, or do men have this problem?
Mostly women. We do see it in men as well, but pregnancy and for whatever reason female hormones tend to cause this more than in men, so we do see it more commonly in women.
Is it just a problem as far as looking bad, or are there some health problems associated with it?
Spider and reticular veins fall into kind of both categories. Many times it is simply a cosmetic issue. There's no underlying venous problem that really lends to it. Hereditary, whatever it might be, you just happen to have them. Sometimes there can be an underlying venous condition. So often before we do treat spider veins, we like to look for any underlying problems with the veins that need to be treated before we go ahead with any cosmetic treatments.
Okay, how do you treat someone with spider veins?
Well, there's different ways that they can be treated. We find that the most effective way is actually something we call injection sclerotherapy. It's been around for a while. Fortunately, we have even better drugs now, FDA-approved drugs to help treat these veins. Essentially, we're using a very, very tiny needle and using that needle to inject these veins with this solution that inflames the veins and causes them to close down long term.
Does the treatment cure the problem forever, or could you have to come back? And
you might have to come back. What it does is it treats the veins that are there currently, and it takes care of those. But being someone who's prone towards it, there's no guarantee you're not going to develop some new veins in the future. The nice thing is with this kind of therapy, you can stay on top of it.
Fantastic. Thank you so much.
Absolutely.
If you would like to learn more about spider vein therapy as well as varicose vein therapy, be sure to reach out to Raleigh Radiology on the web. The address is RaleighRAD.com.